Welcome to journey number 3. Informed consent or informed confusion? A surgeon reflects. You know the moment when a doctor tells you what's going to happen, and then you realize after the fact that you didn't really understand what they actually meant. Yeah, that one. Today we're going for the messy, the awkward, the often confusing reality of informed consent. I'll be sharing extracts from 2 recent conversations I had with Constantin, a young surgeon whom I met 2 years ago when he asked me that I help him prepare for the OET exam. Fast forward to now, I'm helping him get ready for a job interview, and we're taking it way beyond making sure he presents a polished CV. Constantin is what I would call a driven altruist. He's really interested in us looking back together so he can see himself in a new light, notice his blind spots and his inconsistencies, and move on with clarity and compassion as a healer that's skilled in using both the scalpel and words. Now, I have his permission to share. Constantin sees the value of having such open conversations about the realities of patient communication, hoping to improve the quality of healthcare, beginning with himself. Once again, I find I can be more useful as an attentive, non-judgmental listener, poking at inconsistencies flying under the radar and revealing tension points. I try to essentially create a space of safe discomfort so Constantin can notice and connect the dots for himself. After all, he's the surgeon. You'll hear him reflect on how he found himself in the position of telling a patient she'll need a permanent colostomy bag, and how he used the spikes technique to make that conversation a little easier. For those who do not know, spikes stands for S, setting, such as time and location, like minimizing interruptions, maximizing privacy. P, perception, as in getting a sense beforehand about what the patient might be thinking, expecting. I, invitation, is a reminder not to assume you know what the other wants to know, but to ask, to invite. K, finally, knowledge, is the news itself and details that would be relevant and meaningful to the patient. E is a reminder to not ignore and avoid emotions and the need for empathy. S, to summarize and strategize, making sure the patient has understood the news and the discussion ends with steps to take that can make a bad situation feel and objectively get less bad. That's spikes. If this is the first time you are hearing about spikes, or you realize you kind of forgot about it, I strongly advise you look it up. It can be quite helpful when communicating bad, sad, or difficult news. Just don't expect it to work miracles. As Constantin himself has found and also realized that as much as we try to communicate clearly, we sometimes still leave each other in the dark. He has been on both the giving and the receiving end of medical surprises, as you will learn if you listen. It turns out doctors don't always get fully informed consent either. So, let's get to it. Ready? So I asked Constantin to tell me about a challenging situation, and this is what came to mind.
Just last week, I had a patient admitted for a surgery next day, and I had to get her consent for the surgery.
Okay.
It was certain, like her surgery was for a colostomy. She had cancer, and when I asked her if she knew what surgery was about and what it was supposed to happen in the surgery, she told me like she doesn't know. I followed with other questions asking if any other medical representative talked with her, if she was informed in any way prior to that. She also stated that no.
Okay, she had been informed. Okay.
She had been informed. And from a simple consent, it started to be more of spikes type of communication, because I had to inform her in a certain way that for the rest of her life, she should have a colostomy bag. Yeah.
And she was not aware of it.
She was not aware of it.
Ooh.
I asked the consultant later if he talked with her, and he told me, yeah, he did put that on the table, but in the conversation with the patient, he hoped that there would be a scenario that would allow for another type of surgery. But at that point, when like she performed all the tests, that was the only option. That's why I applied the spikes. I informed the patient. I tried to be empathetic because at a certain point she expressed some emotion.
Obviously, yeah.
And yeah, it was quite hard. I was really challenged. It's not easy to talk with a patient that to tell a patient that her life will change in a day, because she didn't require a colostomy bag prior to that. She had, everything was quite normal except that she had cancer, and she felt okay. She had blood in her stool, but it was not a biggest change in her life. So yeah, I was challenged, but at the end I tried to be empathetic. I informed her. I got to communicate to her about her diagnosis and to explain to her the benefits and what kind of future, what should she expect in the future with the colostomy bag. And obviously I got the consent for her.
Well, what would you have done had she asked for more time to think?
Oh, definitely, I would agree with her. It's not something to take lightly. It's a decision you take for your life, and I would definitely encourage even to take some time to think about it.
So, do you think that by the end, did you get a sense that by the end of the conversation, she was fully aware of those like lifelong consequences?
I don't think so. I mean, it's something hard to swallow, to have in a position to take such a decision like in a day,
Yeah.
and to fully get like the whole information, like what it implies, even if it's explained to you by a person that doesn't have a colostomy bag. I think that's a big issue here that maybe we could improve in the future. But
Definitely. So what you're saying now, what you've just said, comes into a bit of a conflict with what you were saying, and of course I got her consent. You're just saying that it's unreasonable to expect someone to, maybe she consented, but was it an informed consent? As you continue to describe the situation, you're starting to describe the fact that it's unlikely that it was an informed consent.
I'm a professional. I explained to her from a professional standpoint what a colostomy involves, but it's really hard to prepare the patient emotionally and physically for a colostomy bag. Because it implies a lot of change from her side, not from mine.
Yeah. So in a bureaucratic sense,
Yeah.
you ticked the box of obtaining consent.
Of course I did.
Yeah. But in the way that you yourself are describing, you're acknowledging the fact that that single conversation and that single day are likely not enough for her to fully absorb the consequences of that decision.
Yep.
And now she has a colostomy bag.
Yep.
And what does she think?
I discharged her today.
And what did she say?
She's well, to be honest.
Yeah.
Yep. Her mood changed for the better.
Okay.
She cried less, I would say, like for the last week. But yeah, she had cancer. Now she's cancer free.
Okay.
Say it's like a big big thing to take into consideration, given the fact that it was like her last chance.
Yeah. Okay.
She tried everything. She knew that she had.
Okay. She had tried.
Yeah, she tried chemotherapy, radiotherapy.
Had tried previously. She had already tried.
Yeah, she already tried. That's the protocol. And that was like the last resort. Like we prepared, in a way, we prepared her for that. But she didn't know like the surgery would imply a colostomy bag.
Okay. So there were some circumstances leading her to understanding that this was the best way.
Yeah,
And at the same time, it's a tough pill to swallow in a single conversation and a day.
it was the only way, to be honest.
Okay.
It was like the only procedure that would allow her to get rid of cancer.
And you mentioned that there's potential to do better next time. How? If you were the medical director, which you one day will be,
I think
how would you improve?
Community with patients that have a colostomy bag that would be able to come and talk with these patients, like a community that could be approached by this kind of people that are expect to have this procedure in the future would be something beneficial.
So like a patient support group, patients supporting each other. Yeah. Because I agree with you. Nobody is better equipped to provide practical advice and empathetic, genuine empathetic reassurance that resonates than someone who is in the same situation, a similar situation.
Yes, totally agree. I know for a fact that we don't have such a group in here. And if I knew that we have such a thing in our hospital, I would definitely recommend this patient to have a conversation with a representative. But with what I had at hand, I did my best. Yeah. But also, I think in a way I stepped into your mind there.
How's that?
With you switching it from like, if you reflect on that, like you didn't do your, I was like, oopsies.
I was just listening. No, I was just listening. We are humans. We are full of contradictions. We are all colors at the same time.
Yep.
Pretending to be just pink is not useful. Yeah. Much rather notice, acknowledge, reflect, and make sense of the mismatches and the contradictions and the zones of dissonance that occur. Because those points of tension, those areas of tension, is where growth happens.
Yep.
Yeah. And cut. This is the end of the first extract, and now on to the second, which is from a conversation taking place the week after, when we revisited the situation of the patient with the colostomy bag, and now we take it into some new territory, share our experiences as patients, and he shares more experiences he's had as a young trainee and a surgeon. I'm really sorry about the quality of this second extract being not great. On to part 2, which begins directly with the S in spikes, if you remember what that was.
It's not easy to apply.
No.
Right? Because like even the first thing, the setting, sometimes you don't have even that.
Yeah, very true. Yeah.
Especially when there are 3 other patients in the room, and the only thing that separates from one another is like a curtain, really transparent almost.
Doesn't stop sound from traveling.
Yeah, unfortunately. And to be honest, I gave the woman 1 day to think about it.
Mm-hmm.
In Ireland, when I'm in the plastics, the doctor allowed the patient 20 minutes up till the surgery. The kid had six fingers.
Okay.
Yeah, so to cut one finger but it's also involves surgery, maybe
Without the pinky,
20
without
minutes,
the
20
second
minutes
pinky.
before surgery.
Without Why would you? Oh, I would want to keep all fingers. Oh, play guitar, play piano. Oh.
Oh, no. It was from the feet.
Ah, okay. More balance.
But anyway, they don't.
Yeah.
It didn't look like they
Yeah.
give their patients more time.
Toes.
Yeah, it's not a colostomy of course, but still, now that I'm thinking about it,
people do need time to absorb the implications, whether, they agree. The situation may pressure them into agreeing, and then they may regret. Which may, with the colostomy bag, you explained that there was no other way. The alternatives were all worse. Yeah? Yes.
I fell into that trap.
Uh-huh.
But I didn't know that after I'll have the braces for they started with 2 years. Then it went for 3. Somehow I had them for 4. And after that, they told me, you need retainers after retainers, but on the other side. Yeah, I have retainers, and I have to wear plastic retainer, I don't know how it's called, during night.
Like a mold?
Yeah.
During the night?
It's such a scam.
Well, it makes you more compassionate and understanding to people who have to put up with long treatments and devices and things.
But the thing that you were tricked, this idea was leave my head.
Yeah.
They didn't tell me about this at the beginning.
And it bugs you, and it stays with you.
Yep.
Yeah? Yeah, that you were...
No, don't tell me now that that's what I did with the patient colostomy. Yeah, but notice that in conversation, because alone you wouldn't do it. You need an interlocutor. You're kind of in a zone of safe discomfort. That the more you think about it, and the more you flip it on the face, and you find that you yourself, you don't appreciate, being talked into things that then have impact.
Yeah, they are. They come with baggage.
Yeah. Now, one idea just popped into my head. It becomes something so routine that you don't explain what you're doing to the patient. Yeah. Mm-hmm. And now I'm just pop, taking the dressing off, betadine. Without telling anything to the patient, it's gonna hurt, it's gonna sting, it's gonna.
You would not do that to me.
That's something. Sometimes I explain when I actively think about it, mm-hmm. But sometimes I'm so into my head and into what I have to do next that I simply forget. And thank God I'm not dealing with patients like you. It's Romania, and patients believe and trust in me wholly.
I would trust in you, but I'm so freaking out in my head that no, I need to know what's going on.
Yeah. No, I also believe in this.
Yeah.
How do I say it? Not mindset. It's an ideology, a mm-hmm. whole ideology, mm-hmm. to be honest. Mm-hmm. Nobody told me anything. From the patients, they are super chill all the time. They don't ask questions. If they do ask, I answer them as I would do to anyone.
Yeah.
Because I understand that they are interested. They are the interested party. But yeah. I think that's what I would want to change in me. To actively explain them to all the patients. Mm-hmm. To mm-hmm. use it like that.
To make it part of your default.
Yeah.
Mhm. Mhm. Well, I hope you do.
Mm.
I hope you do. And the fact that you've noticed it and you've called it out for yourself.
I noticed it just now.
Well, That's the value of conversation, safe discomfort.
Thank you.
Yeah. And cut. So what do you think? Have you ever had a moment where a doctor or anyone really told you something big and you only understood some of it? Have you ever been the person explaining something only to realize later that maybe you left some of the important part out? Have you ever had to deliver difficult news that you knew would change the future of the person you were talking to, or at least their view of the future? Let's talk about it. Drop a comment if you like, share your thoughts, or just think about it, or talk about it with your colleagues or your patients. Constantin and I agree that if at least one of you listening feels inspired to think back, on your past conversations, difficult conversations, and find any inconsistencies flying under the radar, as I was saying earlier, and you decide that your default setting needs to include doing better next time, then great.